Hello, I'm Dr. Ronald Kolanko, President of Brain Brilliance Incorporated. I'd like to discuss the genesis of the Brain Bright Care program. 32 years ago, during Thanksgiving holiday, a 2-month-old, healthy, normal, intelligent boy became ill with otitis media. Virulently in a few days, the condition infected his central nervous system, manifesting itself with encephalitis, polyneuritis, and seizures. The condition left my grandson, as we called him, K2, in a vegetative state, mass of protoplasm, non-responsive physically and vocally to any form of stimuli, and at death's door. He was hospitalized prior to the onset of the central nervous system disorder. He was placed on antibiotics, anticonvulsives, and palliative care. Several renowned pediatric neurologists were brought in on the case. All had the same prognosis. Nothing more could be done, death in days to a few months. At most, institutionalize him with around-the-clock nursing staff with palliative care and maintain the anticonvulsive drugs to prevent stroking. Stroking would end his life. After approximately a 6-week hospital care at my usual late night vigil, early morning, while saying prayers and talking to him, I noticed a tear flow from the corner of one eye. God gave me a sign that there was something remaining in my grandson's brain. That morning, during the medical physician's early rounds, I told him that I was taking K2 and his parents into my home for care. K2 was kept on anticonvulsive medications and 24-hour watchful care. A program of chiropractic care was instituted using manual manipulation, acupressure, and physical therapy to balance the central nervous system. My friend and colleague Dr. Whitman created a forward-thinking detoxification and nutritional program. Unfortunately, this forced us to use numerous bottles of nutritional products to provide the needed ingredients for K2's consumption. Difficult for a patient during the early stages of care, when swallowing was almost non-existent and very difficult to perform. We incorporated assistance from various allied non-allopathic caregivers as the level of recovery would allow them for their treatments to be effective. He was 8 years old before he could jump, having both feet off the ground simultaneously, approximately a ½ inch. His journey to stabilize health continued through the high school years. I am thrilled and grateful to say that he is presently 34 years old, college graduate, gainfully employed, married, and a father of 3 sons. This dramatic outcome has driven Dr. Whitman and I to this point in time, finding courses of care and positive outcomes, delivering hopes to persons afflicted with disconnect syndromes. Thus, Brain Bright Care programs, diet, physician protocols, and microsynergistic nutraceuticals have evolved. Our presentation today will include a plethora of information regarding disconnect disorders of the central nervous system. The topics are: what are microsynergistic nutraceuticals? Differentiate microsynergistic nutraceuticals from commonplace nutritional products. Utilizing diagnostic procedures and monitoring disconnect clinical outcomes. Learn of the unique Brain Bright products and their sophisticated delivery systems that maximize absorption. You'll also learn to incorporate the Brain Bright Care program to care for disconnect disorders utilizing Brain Brilliance products and helpful adjunctive protocols.
After 3 decades of research, the time has arrived for Brain Brilliance. You can be the first doctor in your community to offer our nutritional formulas that are designed to enhance the health of the nervous system tissues. Years of research and the application of various nutritional programs caring for a patient population have produced amazing clinical outcomes. The Brain Brilliance family of microsynergistic nutraceutical products targets disconnect brain and central nervous system disorders such as Alzheimer's, dementia, ADHD, and brain injuries. Brain Brilliance represents several extremely avant-garde, cutting-edge, and therapeutically important nutraceutical products that are essential to effectively support the brain, central, and peripheral nervous system, cellular, and its tissues' health. There are no pharmaceuticals on the market today that promise a cure for any disconnect brain and central nervous system disorders. 3 Brain Brilliance nutraceutical products have already launched: Brain Bright Enhancement, Brain Bright Detox, and Brain Bright Night. Each has its own unique formulation. You won't be able to purchase these in stores. Instead, patients will have to go to an authorized Brain Brilliance doctor who will follow a strict protocol in the administration of the Brain Brilliance products. The protocol will involve preventative and therapeutic programs outlined in detail by Brain Brilliance Incorporated. The protocols parallel years of research that have proven effective. Only physicians who are educated in the proper use of Brain Brilliance products and follow the outlined protocols will be allowed to distribute Brain Brilliance. Physicians that offer Brain Brilliance products distinguish themselves uniquely in their community and develop a practice within a practice that will assure the highest standards of patient care will be accomplished. Ethan was 4 when he started the Brain Brilliance program with Dr. Michael Whitman. He was diagnosed with autism soon after birth. He was nonverbal, didn't talk, he was non-social, and wouldn't make eye contact with anyone. Dr. Whitman found he had food sensitivities to wheat and dairy, and he was on a very limited diet. Whitman also found heavy metal toxicity and toxic chemicals affecting Ethan. He started him on a program that included nutritional liquid supplements and a spray metal detoxifiant, along with his special chiropractic adjustments. Approximately 6 to 8 weeks later, a miracle. A whole new boy started to emerge. He started jabbering and chatting like crazy. It was like he was discovering people and things for the very first time. Now, he's started kindergarten with the other kids. He still has challenges and he's a little slower than some of the other children, but he's still a whole new boy. Harvey Edwards of Indiana is another success story. Suffering from memory loss, Edwards began the Brain Brilliance regimen under the supervision of Dr. Adrian Hagedorn. Here's what he had to say.
When I started care, I was really in dire straits. My memory was terrible, and I've always prided myself on my excellent memory. But my memory had become so bad, I truly thought I wouldn't be able to keep up my business. Well, after Brain Brilliance, all that has changed. My memory is back. I really think I'm better than I was before. People are always remarking on it. I can also handle stress so much better. Just the other day, I tried to remember the name and phone number of a person I had not talked to in 10 years, and bang, there it was. I'm like a new person, physically and mentally.
Cheryl's daughter, Michaela, also benefited from Brain Brilliance. Not able to focus in school, Michaela began the Brain Brilliance protocol under the supervision of Dr. Michael Whitman.
She knows what she's supposed to do, she knows her regimen, but since we started taking them, her focus has become better. She has actually improved in her grades. In fact, today she got her 94% on her phonics test. It's just been a very good experience for us.
At this time, I would like to introduce my friend and colleague, the wonderful, talented Dr. Mike Whitman.
The last 10 years, the amount of ADD, ADHD has just exploded. Unreal. Our procedures are very specific, our specific testing procedures and treatment and so forth. My thoughts were this: if we could develop a program that was duplicatable, simple, could plug right into any practice and help the majority of these disconnect syndromes, ADD, ADHD, depression, sleep disorders, memory disorders, chronic pain, then it would be a godsend to the chiropractic profession and many others. And so basically, we worked on developing this procedure. I am the clinical researcher, the formulator, and the developer of the Brain Bright products. They've been tested in my practice with me and my associate, Dr. Adrian Hagedorn, and we have had dramatic success with it. So we know it works, and that's extraordinarily important. So basically, what we're going to do now is I'm going to explain to you the protocols and the products. The products are extraordinarily unique in that Two of the products initially are sprays, oral sprays. Why oral sprays? We had so many children that they won't take pills. You know what I'm talking about. You simply know what I'm talking about. The sprays are simple, they taste good, and they're extraordinarily effective. We have a powder, a whey powder, purest grass-fed organic powder on the market. And basically with that, we have a number of other things that go with that, which I will explain in a very short period of time. And so basically, what the Brain Bright program is, it's a duplicatable, consistently successful, plug-in program that you can start the next day after purchasing the products. So now what I want to do is I want to go over these products and how you use them. Let me explain something to you. I have a little bit different practice. We see patients from many states around. I'm in Brazil, Indiana, a little small town between Indianapolis and Terre Haute, Indiana. We have patients travel here from the state of New York. We have people come from many, many different places. A lot of them for the disconnect syndrome problems. And so basically, we see patients once a week for 6 weeks. Then usually once every other week for 12 weeks. Many of them then will come once a month for 6 months. And we're able to use our procedures, our chiropractic procedures, various acupuncture procedures in some cases, and the supplementation and diet modification to successfully treat these type of conditions. There are 3 primary ways you can evaluate your patients to see if they would benefit from the Brain Bright program. If you are a Corinne-specific practitioner, basically you can use these points and use your occipital drop as the evaluator. This is from the work of Scott Monk, DC. This is functional bioanalysis points. This point here is called conception vessel 24. If this point is positive, by positive it would be you have the patient take their finger, touch the point, and if you get an occipital drop, it's a positive finding, which indicates this particular person has low dopamine utilization or production. The next point you would check is up here, bladder 1. And if the patient touches the point and you get a positive occipital drop, that indicates low serotonin levels. The Brain Bright program, the sprays, both the enhanced, the detox, and the powder, Brain Bright Night, treats those things very effectively, along with our diet modification and your chiropractic treatment to balance the central nervous system. So basically, the patient touches the point, you check. The patient touches these points, you check. A positive finding would indicate the need for the Brain Bright program. Now, go ahead and lay back here if you would, Adrian. Basically, if we're doing kinesiology, you can use any of your forms of muscle testing. If you're going to use basically deltoid testing, you would do the same procedure. You would see CV24. If the patient goes weak, that's a positive finding. Bladder 1, the patient goes weak, that's a positive finding. I personally use a procedure called O-ring testing, where the thumb and little finger are pressed, and we go to these points, and it is positive. And we go to bladder 1, and that's negative, but CV24 was positive, indicating a weak muscle. So that would indicate the need for the Brain Bright program. And basically, the other methods and means that you can use the Brain Bright questionnaire. This is the Brain Bright questionnaire. It's in 3 basic parts. Category 1, 2, 3. Category 1 would specifically indicate the disconnect syndromes like ADD, ADHD, OCD, these type of situations. Category 2 is more for sleep disorders, anxiety, panic attacks, and so forth. Category 3 is for chronic pain. Always remember, if you're dealing with a chronic pain syndrome and it's a spinal syndrome, oftentimes the primary problem isn't in the spine, it's in the brain. So these are 2 ways that you can evaluate the patient's need for the Brain Bright program. The third way is doing a clinical evaluation, a 6-week study on the patient using our protocols, the Brain Bright protocols, and usually our clinical experience has shown 92% of the patients will respond positively within a 6-week span. And so basically you can do just a clinical evaluation by giving the protocol of the Brain Bright Enhance, Brain Bright Detox, and Brain Bright Night with the absolutely necessary diet modification and the chiropractic adjustment. So now let me just explain the products and go through them with you. The first product we're going to talk about is what's called Brain Enhancement. Brain Bright Enhancement. It's a spray. And this spray, we call it magic in a spray. But basically there's a number of products that went together in that. Now remember I said I was working with this disconnect syndromes, which is ADD, ADHD, and you know, I'm just going to say ADD. 50% of all ADDs do not have the hyperactive component to them, along with anxiety, depression, and so forth. In just this last 10 years, the amount of these conditions have exploded. And how are they treated? They're treated with an amphetamine-based drug, Ritalin, for instance, Adderall. And basically, what does that do? What does it do? It causes all kinds of changes in the body. It causes blood sugar handling problems. It causes changes in the brain. It doesn't repair the brain. It literally distorts brain function. It creates an addictive personality in the patients that take this repetitively. So you can see the dramatic effect on society when we have so many children and adults taking these pharmaceuticals because they don't know there's an alternative, a safe, effective, healthy alternative. And so let's talk about the alternative, okay? We're going to go through the products and I'm going to simply explain the diet modifications, which is essential, and the absolutely essential component of balancing the central nervous system, the chiropractic adjustment. All right, so what is in Enhance? We have some functional ingredients that fills the pathways of almost all neurotransmitters. B6, folic acid, B12, pantothenic acid, and magnesium. These are essential pathway fillers so that these products can go to work and help to balance neurotransmitters, specifically dopamine and serotonin, which I had showed you on our testing part of this. Basically, what's in it? L-theanine. What is it? It's an amino acid. It's also found in green tea. But basically, it reduces anxiety and reduces abnormal fears. It stimulates focus and attention without causing drowsiness. L-theanine. Tyrosine. Tyrosine is the base amino acid that produces dopamine. Now, also, you're thinking as I go through this, I'm sure you're saying, that's all in this little thing? Yes, it is. It's a very low dosage, high potency formula. That makes it so unique. The delivery system is extraordinary in reference to its effectiveness. You will see, if you do muscle testings, immediate muscle strengthening upon application of a spray. Very dramatic. DMAE. This has been shown in a double-blind study with Ritalin to perform better than Ritalin without the side effects. DMAE. Problem? Yes. High dosage causes muscle pain, but our dosage does not. Along with the synergistic factor that's involved in it, it does not cause any problems. And you'll hear me say this, micro synergistic nutraceutical. What's that mean? Small components that fit together and make something work much bigger than its actual dosage is. That's what micro synergistic nutraceuticals means. And so these things, they complement each other and literally make it work at a higher level of potency because of the synergistic communication these nutrients have. DHA. EPA and DHA is what fish oil is made of. DHA is a superstar for brain health. For brain health. Think about this. If the mother breastfeeds and is deficient in DHA, the child's risk for disconnect syndromes is out of the roof. Out of the roof. And what we're seeing today is a generation of mothers deficient in DHA, giving birth to children grossly deficient in DHA, and the ramification of the disconnect syndromes are everywhere. So DHA is an essential component to this program. There will be those rare cases that you're going to have to actually supplement more DHA along with the spray, but it isn't common, but it does happen in severe cases. The LESA-PS, what that literally is, phosphatidylserine, all the lecithin components, the choline-based components to the brain, and extremely important in brain function and brain health. GABA. GABA is an amino acid that reduces the excitotoxic effect of the brain. It slows down the excitoreceptors. So if you're very anxious, you have problems with sleep disorders and so forth, GABA can be very effective. Green tea extract. It is an extreme antioxidant for the brain to keep the brain healthy. It also has theanine in it, which I spoke about earlier. But now they're researching green tea as a therapeutic agent for dementia and Alzheimer's. So green tea extract, organic green tea extract is very, very effective. That's the substance and the ingredients in the enhanced product. Usually, according to, you can test or you can use our protocols, the dosage of the enhanced spray will be from very, very small children, maybe 2 a day, up to 4, and adults maybe 8, 2 to 3 times a day sprays. It varies according to the specific case and the specific problem that you're dealing with. Now we move on to Brain Bright Detox. Let me say this. There are many, many detox procedures out there. How many do you know that helps to move toxic metals and chemicals out of the central nervous system? There's the key. There are some. Very expensive, but there are some. This Brain Bright Detox moves toxins, metals, specifically mercury, lead, and aluminum, out of the central nervous system. It's your immune system that does the work. This is a complement to your immune function. What's in it? N-acetylcysteine. It is extraordinarily powerful detoxifiant for the central nervous system, for the brain and so forth. R-lipoic acid. R-lipoic acid is a water-soluble and an oil-soluble antioxidant, and it helps to remove poisons and toxins, metals out of the central nervous system. Chlorella. You probably heard of chlorella. This is one of the common ones used for detoxification. Many times there'll be chlorella protocols for people that want to have mercury, their fillings taken out, so they do a chlorella protocol prior to mercury removal or amalgam removal. Chlorella is in our products, our detox product. Now what makes this product so unique. It has humic and fulvic complex. What is that? What is that? Ever hear that? It's peat moss. It's organic, well, if you can call it organic, it is organic, but it's peat moss. And it has a dramatic effect on pulling toxins out of the system, specifically the central nervous system. That's our thrust in this, the central nervous system. With the chiropractic treatment balancing the central nervous system and our products and diet modifications, miracles happen. The next product we're going to talk about is the Brain Bright Night. It's a powder. And basically, it combats oxidation of the brain. It feeds the brain and removes a lot of oxidative problems in it. It's very rich in alpha-lactoalbumin, which has been shown to be very effective in some cases of dementia and Alzheimer's. It's a very effective powder. It is anti-inflammatory. And quite frankly, the basis of all these conditions, well, the basis of all chronic degenerative disease is inflammation. I don't care if it's heart disease, if it's cancer, if it's arthritis, or dementia, or ADD, ADHD. There's inflammation there. That's why our diet program is so important. You have to reduce that inflammation for proper central nervous system function. This helps to do that. By removing stressors with detox from the system, that removes inflammatory components. By feeding the central nervous system these basic nutrients we went over, we're able then to see improvements in overall neurotransmitter function and production. And in this product with the whey, we have blueberry powder. Why blueberry powder? It's been shown to be an extremely, extremely effective antioxidant for the central nervous system. You know how important the antioxidants are. And basically, you say, well, good, I'll just eat berries. The studies show that the berries do not have the same effect as this concentrate does. So the blueberry powder that's in the Brain Bright Night is very effective as an antioxidant. We also have in Brain Bright Night resveratrol. It slows brain aging. Resveratrol has been shown to stimulate the genes in your body that slows down aging. Yes, that's true. It increases circulation to the brain. Also, it has DHA again. Remember, the superstar, essential fatty acid, omega-3 fatty acid. Always remember we're talking inflammation, and where do we get a large portion of our inflammation? Omega-6 fatty acids, vegetable oils, which are everywhere. It just inundated in everybody's diet. What does EPA and DHA? It's an omega-3. It's an anti-inflammatory oil besides feeding the brain. Remember, 60% of your brain is fat, and DHA is a major component of that fat. So if you have patients taking cholesterol-lowering drugs and showing early signs of dementia and so forth, you've got some answers to what's going on there. CoQ10, it enhances neuroenergetic pathways. CoQ10. Alpha lipoic acid, like our lipoic acid, is an antioxidant, both water-soluble and oil-soluble, that crosses the blood-brain barrier. Essential. Phosphatidylserine, it comes up again. It's improvement in mood, memory, and motivation after 30 days of use. This has been shown clinically many times. There are reports of phosphatidylserine actually reversing many of the acids on its own now, at very high doses though, of reversing many of the symptoms of dementia. Now, what about the diet program? This is our diet book. And what does it base on? Now remember I said in my practice for the last 3 decades we do very specific diet testing, food testing. Well, not everybody does that. And there's all those people going without care all over this country. So we have taken the most inflammatory based foods that affects the central nervous system and told you how to eliminate them. What is the first one? It's gluten. There's a book called Brain, and basically Dr. Pierre Mueller, who is a neurologist from Florida, wrote this book, and it outlines the dramatic effects that gluten has on the inflammatory process in the central nervous system. Gluten. A lot of people will need to restrict sugar. It's just a natural, it's an inflammatory agent. I don't care who you are, what you are. It causes inflammation. If you have an inflammatory symptom complex like disconnect syndrome, you better limit your sugar intake, big time. And it goes through and it explains all the products that has these things in it. It talks about balancing those essential fatty acids, remember? Okay, omega-6s in this society, in America, grossly outweigh the omega-3s. Thus, the epidemic of inflammatory diseases, heart disease, cancer, diabetes, dementia, Alzheimer's. You have to balance those omega fatty acids. It's essential, not only for disconnect syndromes, but for your overall health. You're going to have a percentage of parents that's looking for an alternative to that drug. But you have this rather substantial group of people that's looking for an answer, an alternative. And that's what this is. That's why the compliance is so good. The research now shows that this generation of children will be the first generation not to live as long in years as their parents. What in the world's going on? So this is Brain Brilliance, the Brain Bright products. And you can build a practice inside a practice with this concept and do amazing things for your community. And not only for your community, look at the prestigious concept as a doctor you will take on with a consistently successful program like this. I thank you.
Hi, my name is Faith Edwards, and I've been a patient of Dr. Whitman and Dr. Adrian for 10 months now. And my only regret is that I didn't call them 10 years ago. This time last year, I was a very different person. I was very sick. I had been diagnosed with several different incurable diseases. I was in chronic, debilitating pain. I had lost my job. I had applied for permanent disability. I had no hope, really, of ever getting better. I was on 12 different prescription medications every day, and that's what we got it narrowed down to, basically. I was in a doctor's office of some sort at least twice a month, getting experimental treatments and anything else we could think of, surgery after surgery, to try to have somewhat of a normal life, and it just wasn't working. I had a couple of friends that told me about Dr. Whitman, and so I decided to call Dr. Whitman just to kind of check it off my list and say, there, I've done everything. And we came into his office, and he just started doing a normal checkup, and he started listing off all these things that had come out in lab work and scans and surgeries and any kind of test you can think of that I'd had over the last several years. He was telling me all this without any kind of imaging machine, not even any blood work, anything, and it kind of caught my attention. And then we went and sat down in his office, and he said, you know, you have inflammation all over your body, which is what all the other medical professionals had told me. Then he said, we're going to figure out why, and we're going to figure out how to fix it. And I think that was the moment that my husband and I fell in love with Dr. Whitman. No one had ever offered us any hope, or there just wasn't any way to figure out what was going on and how to fix it. So it was brand new for us. And after just 2 treatments, I started feeling better, and I thought, it's got to be some kind of hoax, you know, something's going on. I just happen to feel better. And then after a month, I started to think, you know what, this guy really knows what he's doing, and I really am getting better. After about 3 months, I thought, I'm better. I'm great. I'm back to myself. You know, I'm living again. I'm better than I've felt in 6 or 7 years. They gave me my life back. They gave me my family's lives back. It's just an amazing difference, and I'm so thankful.
Faith's initial diagnosis were interstitial cystitis, irritable bowel syndrome, colitis, endometriosis, fibromyalgia, prediabetes, high blood pressure, depression, migraines, sleep disorders due to chronic pain, and drug dependency. The standard medical examination was utilized. This was coupled with the biofeedback program of Koren-specific technique to help determine the neurological deficits of Faith and monitor the effectiveness of the Brain Bright Care program throughout her treatment. I hope that you enjoyed Dr. Whitman's presentation. I thought it was wonderful. I would like to talk to you about building a successful disconnect disorder specialty practice. You'll be able to develop another stream of patients within your practice. Many millions of children and adults suffer from ADD and ADHD. These conditions are not only found in children because they grow up to be adults. Everywhere you go, someone has a child, sibling, parent, relative, neighbor, or co-worker with the problem. The masses are growing as we speak. The present standard of care is to neutralize the aberrant behavior with pharmaceutical products that suppress one's activity. Unfortunately, this dulls one's reality, reduces energy, and causes systemic organ disorders. The patient does not function in life to the fullest. Approximately 39% go on to hardcore drug dependency. This becomes a health and legal problem. The patient is damned if they don't follow the standard of care, and they have other hardships if they do. The good news is the Brain Bright Care program offers another promising avenue for that troubled child or adult to follow. Their program utilizes Brain Bright products and Brain Bright special diet. Also, avoidance of environmental hazards and altered food products. Then we add aerobic and mental exercises which grow the hippocampus. All of these have a very positive impact on these conditions. The results are enhanced by balancing the central nervous system through chiropractic therapeutics, laser, or oriental medicine. The Brain Bright Care program provides the fuel, enabling the nervous system to have the opportunity to recover. Understanding the Brain Bright Care program qualifies you to become a certified member of the Brain Bright Certified Physicians Association Incorporated. You can then join the prestigious group of specialized providers that care for central nervous system disorders. This organization will publicly announce through the media that you are a member of the Brain Bright Certified Physicians Association Incorporated. The public will learn that a specialized group of physicians are available to help with conditions such as attention deficit disorder, attention deficit hyperactive disorders. The news release will include your photograph and the script to be published or announced in the various available media venues. Each member will be listed geographically for a physician's referral purposes. This satisfies the inquiries of locating a local certified physician in their community. The favorable impact that you will have on the health of the afflicted will be overwhelming. The numbers affected with these conditions are staggering, and those numbers continue to grow. They need our help. Are you going to take up the challenge of saving the health of multitudes that are searching for a doctor that has an answer? They live next door, down the block, and are within your zip code. Are you going to step up and be their solution? The Brain Bright Care program is available to help you solve their disconnect disorder condition. It is within your grasp. Step up and join the program.